new epidemic, an epidemic of sudden death. The curious thing about this sudden death is that it enters in the nose also. This sudden death is from a poisoning from contaminated street drugs that are commonly put up the nose. And the most common contamination of street drugs is a drug called fentanyl. Fentanyl is a synthetic narcotic. It's 100 times more potent than morphine. It's very rapid acting. When put up through the nose, it takes minutes to take action. The effects last for 4 to 7 hours. And the most unfortunate thing about this particular pharmaceutical is that it is not only one of the most potent of all narcotics, but it also has the most potent of the worst of all narcotic side effects, and that is respiratory depression. In other words, it'll make the person stop breathing. This is expanding right now among 35 to 44 year age groups. There's a 20% increase in deaths from this since 2020 and a 73% increase from 2019. Now, this is out of the CDC. These are the top-down boys. 2021 increase. And this is deaths from opioids. All of them are increasing. These are increasing the greatest amount, and they're also the highest numbers. So this is where we say the 35 to 44-year-olds are suffering the most number of narcotic deaths. The CDC is saying they're due to opioids. More than 2/3 of the time, cocaine and psychostimulants. This is crystal methamphetamine, Adderall, Ritalin. What about prescribed narcotics versus street narcotics versus contamination? Before 2010, the prescribing habits of doctors were killing more people than narcotics on the street, changing the way doctors prescribed opioids. Now, right around 2010, you see a change. Doctors started to tighten up their prescribing, and people that had been receiving opioids for more than 10 years already are suddenly cut off. And so they began to source heroin on the street. In 2013, the synthetic narcotics, particularly fentanyl, in street deaths, contaminating other street drugs. What do they look like before they go into a coma? It slows down their breathing, and so they start to turn blue. Their hands turn blue, their lips turn blue. What does it look like when it progresses? Well, you're going to see it because the person's not moving. They look like they're sleeping, but they can't be woken up. You'll notice that you don't hear any sound of them breathing. They may start snoring. Their hands and lips are blue, and then they start getting cold and clammy. The solution to prevent the death from this poisoning is Narcan. Very, very rapid acting. It's safe for anyone. So let's take a look at how one would use this in an emergency. The first thing is that you have to open this package. You go for the red plunger guard and you pop that off and then stick it in their nose, push and spray. And then after they start to become conscious, roll them on their side and call 911. Who should have this Narcan nasal spray? All teenagers should have this. Number 2, anyone frequenting gatherings of large numbers of people, and especially for recreational activities. And it can be stored between 59 and 86 degrees, no problem. Should be kept away from direct sunlight. Now, this particular medication is very, very stable. It's got a fabulous shelf life.
It really worked.
It's a lifestyle change.